I discuss today about flexible ureteroscopy, armamentarium basic step for residents and beginners. My name is Amelia Pietropaolo, and I am an associate specialist. I work in United Kingdom, and this is my hospital where I currently work. So this presentation is to introduce flexible ureteroscopy and kidney stone treatment to our residents and trainees. And of course, we need to underline that learning through tips and tricks from experts is much better to come across tricks and tricks because we are in Halloween time, and therefore trying to prevent to learn from bad experience and to prevent complications. So we start from our patient preparation for our flexible ureteroscopy, and clearly it's very important to study our patient, make sure we know about the preoperative urine analysis, and make sure we can prevent urine infection and treat if there is one. And we normally give prophylactic antibiotics beforehand, in particular during the induction of the anesthesia. It's very important the position, as we are gonna see, and be ready in theater with the fluoroscopy, the X-ray team, contrast, and all the equipment we need. As you can see, this is the lithotomic position, and the patient will need to be comfortable and positioned in this way in order to be comfortable, the patient, but also for the surgeon. We normally use a surgical drape to maintain sterility. And it's very important to position the C-arm in the correct place in order to identify and show the kidney area. This is the equipment. Clearly, before starting the procedure, we need to make sure all the equipment is available. And the equipment includes a guide wire, a uretary catheter, a ureterial access sheath most of the time, a port seal that will allow us to insert the instruments in the flexible ureteroscope, and the basket for extraction device. Irrigation is very important, and the postoperative drainage such as stent. Also, the energy source to treat the stone is of paramount importance. We're going to discuss about this later. After having done the final checks, we can finally set up our patient and we can start our procedure. As you can see, the position in theater of all the instrument is very important, in particular in small environments, in order for the surgeon to be able to see the endoscopic screen, but also the radiology screens at the same time. And the procedure is a step by step, and it's very important to follow all the steps in order to prevent complication or unexpected findings. So first of all, we've discussed already about planning and positioning. Second is to do a rigid cystoscopy and cannulation of uretary corypheis with a guide wire. And after that, it's very important to insert the rigid ureteroscope, navigate the ureter, and negotiate the access to the ureter. And after that, there will be the proper stone treatment. Our flexible ureteroscope can be inserted through an access sheath, as we will see, or via a guide wire, and it can be railroaded with X-ray guidance. The fragmentation of the stone can be done with, of course, laser or other power devices, and the mode can be selected to have a fragmentation, dusting or popcorning and dusting technique. And it's very important to have a good vision thanks to irrigation and to choose the best way of drainage after the surgery. We're going to discuss about the access sheath as the first step. So this is very important. It's a very useful aid in terms of flexible ureteroscopy, because it will allow us to introduce our flexible ureteroscope and to remove the fragments with the basket going in and out the ureter without damaging it. Also will improve the vision, allowing a good irrigation and reduce the intrarenal pressure, reducing complication of sepsis. So you can see many sizes of access sheath we can use, and clearly it's very important to avoid ureteric trauma, an access sheath being inserted under fluoroscopic guidance or on a guide wire can clearly cause these sort of problems. How to prevent that? It's very important to test our ureteric compliance first, and in our center is a very important step-by-step procedure to do a rigid ureteroscopy first on 2 guide wires in order to test the compliance of the ureter and make sure we can understand if the ureter is tight or is very wide and compliant, and to select the size of the access sheath according to the wideness of the ureter. This is very important to prevent tears or traumas to our ureteric mucosa. And in fact, we have analyzed our own data, and we saw that we very, very rarely found any intraoperative complication, and none of them have been identified in our case series, with a good stone-free rate, even in large and multiple stones, thanks to this technique. In absence of access sheath, as I said earlier, the ureteroscope can be inserted on a guide wire, and this can be railroaded under fluoroscopic guidance. It's very important to respect the compliance of the UO, and in the more modern ureteroscope, it's possible to navigate backwards the ureter under vision in order to prevent traumas when inserting the flexible ureteroscope and reaching the renal cavities. The laser is of course the most important source of stone treatment. It's very important to know how to select the settings and to play with them in order to have a best result of stone fragmentation and ablation. And clearly we can have a dusting effect with a low energy and high pulse. Other way around for the fragmentation, so a high energy and a low pulse, and a low frequency, sorry. And the popcorning technique or pop dusting can be obtained with a high energy and low frequency. The pulse duration is very important also to distinguish between dusting, obtaining dusting or fragmentation. And there are several papers that you can check that will describe how the stone can be better managed with one or the other techniques. Again, setting the right parameters for stones for laser fragmentation is very important, and we have analyzed our case series with the high power laser and seeing that the post-pop dusting technique can achieve excellent stone-free rate also for large stones with very reasonable operating time and no complication rate. This is possible to be done also in pediatric cases. And to learn how to handle the flexible ureteroscope is the most difficult part. This is my experience. So learn to navigate the collecting system is very important, and sometimes hands-on training can help for that. So it's very important to mainly manage them up and down control. And then also rotating the wrist right and left can help to navigate the system and orientate between different calyces. There is also a more fine movement that can be done with the other hand, with the left hand, to rotate the tip of the scope in order to orientate better into the cavities. And it's very important you remember about the digital ureteroscopes, where you don't have an indication of your position in the space. So the bubbles can help you to understand the position in the renal cavities, if it's in upper pole or lower pole. And the same thing is better to remember there is a different deflection setup for European or American scopes. There are a lot of publications and studies about tips and tricks of flexible ureteroscopy that I can suggest, and about basic ureteroscopy to advanced ureteroscopy. And this is very interesting to learn, in particular in the COVID pandemic time when hands-on training are more difficult to attend. And this is a very important step-by-step training model created by the European Association of Urology section. And they created a 4 steps learning tool to learn how to perform stone treatment, from the flexible cystoscopy to rigid cystoscopy and guide wire placement, rigid ureteroscopy and placement over access sheath, and finally flexible ureteroscope navigation. This is a very interesting curriculum, and it goes through different steps in order to gain the final confidence and competency to perform a full stone treatment. Clearly, doing a semi-rigid ureteroscopy is of paramount importance, as mentioned before, because that gives us the idea of the compliance in our urinary system. And it's important to learn how to overcome the difficulty of bladder neck, for example, of a higher rigid bladder neck, or a difficulty within the ureter, which could be represented by stricture, or tortuous ureter, or a stuck basket, for example, or a stone which is completely impacted, and a situation where the view is very poor. Also, the ULIS training pathway is very important. This is made of 3 basic steps to go from the basic cystoscopy and rigid ureteroscopy to then be able to perform full procedures. This is a sort of fellowship period that will allow the trainee to gain the full experience. See, there are a lot of simulators that have been created to help the trainees and residents to learn how to use the flexible ureteroscopes in a very similar environment to a urinary tract system. And we can see how with our flexible ureteroscope, we can navigate different anatomies and find and grab stones in different areas. This is very, very helpful, I can say, and that I've proved in myself in the several courses. And of course, the training is a modular training. It goes from basic skills to the complete procedures, and this is made mainly possible to do through hands-on. It's very important, the role of mentoring, clearly, because it's impossible to learn without the right trainer, and therefore you can learn quicker and also learn from the experience on someone who's very experienced, and therefore not going towards preventing complications. The new generation of flexible ureteroscopes are more and more technological, and they went from fiber optics to now digital scopes. Clearly, they have different benefits, and the view is very improved, as you can see, between fiber optic and digital scopes. And also, this allows us to save much time during the procedure. Irrigation system is very important to mention, because clearly to have a good view, we need to have a good washout of the cavities and any irrigation. It's very important to select a type of irrigation that will not increase too much or too suddenly the intrarenal pressure, and therefore would prevent episode of urosepsis or rupture of the calyces. Then, of course, there are some limitations related to the reusable flexible ureteroscopes. For example, they're very expensive. To repair them is very expensive, and they're very easy to damage. And they can be infected, because clearly they need to be decontaminated all the time. And they're also very heavy. So new digital flexible ureteroscopes have been introduced recently to the market. There are several brands that I'm not going to discuss about, but they are very convenient in terms of maneuverability and safety, because they are very light and they are very easy to maneuver. And at the moment, it's proven that their use is suggested in case of very large stones in the lower pole, or in difficult anatomical cases like urinary diversion or abnormal anatomy. And very important in patients with previous urosepsis, because they are essentially disposable and they don't get decontaminated. And to conclude, I just wanted to show you a video of how we suggest the step-by-step approach to flexible ureteroscopy. And as I said, the first step is to do rigid ureteroscopy to navigate and test the compliance of the ureter. We normally use a safety guide wire and the working guide wire to go through all our ureter. As you can see, this ureter is very narrow, and therefore we are supposed not to select a very wide access sheath, but probably a 9.5 French. And after inserting the access sheath, then we can safely perform a flexible ureteroscopy, and the access sheath would allow us to remove even large size of stones through it. And as you can see at the end, we can navigate and check our ureter backwards, going out with our access sheath, and make sure there are no damages, as you could see yourself. This is our last video, and it just shows how the different view, first of all, of a digital ureteroscope. This is a disposable one, and we use this type of scope because this case was a difficult case with a patient with previous urosepsis, and you can see how nice and is the view, with a very, very clear view, and it's easy to navigate all the cavities, see the stone, and then treat it with laser, obtaining a very good fine dust that will then wash out with the aid of the access sheath. And this was my last slide, so thank you very much for this opportunity, and looking forward for the MDT discussion. Thanks a lot.